All of life can desert you, all of fortune can desert you, all of opportunity can desert you, but Medicaid does not, as it currently stands.
Medicaid has never been more important. I say that because we are in an economy in which fewer and fewer employers are providing health care to their employees. They can't afford to. We're in an economy where there's fewer and fewer middle-class, good-paying, family-wage jobs. And Medicaid provides that foundation for prevention, that foundation for treatment, that foundation for our children, our disabled, and our poverty-stricken seniors. And that foundation, we cannot take that away.
In 2010, Medicaid provided health care for 68 million low-income children, parents, pregnant women, people with disabilities, and senior citizens, read dual eligibles. Unfortunately, there are members of Congress who want to slash this. Medicaid is always, in many states, sort of the first thing that people slash because poorer people don't vote, they don't organize, and those who don't like them do organize, and they're a vulnerable target, which enrages me as a former VISTA volunteer because that's all I worked with was people on Medicaid, and I loved them. And they were as good as anybody else in the state or anywhere else in the nation. So some members of Congress are trying to turn this into a block grant program. That means federal Medicaid payments to states and counties would be 35% lower by 2022 and 49% lower by 2030.
These state block grant proposals are not about flexibility. They are a mirage. They are a backdoor cost shift onto local governments that are already walking on an economic tightrope.
Block grants mean that the federal government absolves itself of responsibility, dumps everything on the counties. The counties can't afford to do a lot, so then they have to raise taxes or cut services.
What do you think happens if the Republican proposal of slashing hundreds of millions of dollars off of Medicaid takes place? What do you do when you are 50 years of age and poor and you have a problem with your heart, or if you have cancer and you have no health insurance at all? What do you think happens to you? I will tell you what happens to you. You die. That's what happens to you. So what we're talking about when we discuss slashing Medicaid is a death sentence for God knows how many thousands of Americans.
It's a heartless town, and this is a heartless budget, which has come over from the House, but frankly, some of the amendments that are being offered in the Senate are even worse than the House budget. So the reason we're all here is because we're up against it, and because we care about people, and because Medicaid that's the one group of people, whether children or whether with disabilities or dual eligibles, they can't defend themselves.
It makes no sense. Makes no sense morally, and I don't think it makes any sense for the future of this country in terms of our prosperity, because we all do better when we have a middle class, a strong middle class, and this is going to put that middle class at risk.
So we've got a fight on our hands. Morality is on our side. Economic justice is on our side. And we're going to win this fight.
We're here to tell you that we are not going to let government here in Washington, D.C. customize the poor out of real health care security. And that is the bottom line.